Okay. My name is Tim Allison, a successful patient of Dr. Chockalingham's. It has been now over 1 year since my treatment was completed by Dr. Chockalingam. And during that time period, I've had no recurrence of symptoms at all. What brought this on goes back a few years ago, where I had a slip and fall onto my front porch and did a pretty hard smack of my head on the deck itself. And apparently that broke loose the sacs of things, particles in my ears that determine balance. So I had dizziness brought about as a result, and it was a function of problems in both ears. It was caused by the concussion and the concussion alone. I simply endured it, but about a year later, the symptoms were just too powerful for me to contend with. So I mentioned that to Dr. Best, my pain management physician, and he suggested Dr. Sarah Van in Chockalingam, or Dr. Van. And that turned out to be a godsend. Because after when I experienced these symptoms before, I went to my primary care physician, and he sent me to an ENT doctor, ear, nose, and throat. This first ENT treated me with a device, a technology-oriented treatment to get these particles back where they belong inside my inner ear. And then I had to sit up for 48 hours, meaning I slept in my lazy boy for 2 nights. But I did so, and it cleared up. But same pattern. Within a year later, the symptoms are back. They're powerful. Too much for me to contend with. So my primary care doctor sent me to another ENT, part of the same practice. This doctor treated me without a technological device, but treated me manually to do the same thing. Get those particles back in the membranous sac where they belong. And but I had the same results. It cleared up. And I did my sitting up for 48 hours, and about a year later, the symptoms were just too powerful. And this time I mentioned it to Dr. Best, as I think I mentioned earlier. He recommended me to Dr. Chockalingam. One thing that I found particularly revealing was when Dr. Chockalingam had me do certain exercises, if you will, just to see what was going on. But he had me put on a pair of eye goggles and recorded my eye movement. That was a powerful for me, because he played it back, and I was able to see exactly what was going on. My eyes were fluttering. And that was part of the dizziness. And for me, the dizziness wasn't powerful enough to bring on nausea, but it was powerful enough to where, like, I'm in bed, I have to sit up, to get up and go to the bathroom or whatever. And I had to learn to sit on the edge of my bed for 1 minute to 2 minutes until my dizziness cleared and I was safe to get up and walk, because I did have occasion to fall from the dizziness. But when I came back the second time, Dr. Chockalingam, again confirmed his diagnosis through examination and the video of the eyes. And then we began doing exercises here in the doctor's office, and then also do them at home. And that's something that's, I'm sure, is particularly important, to do those exercises at home, not just dismiss them or minimize them, but do them, just as instructed. And that works with what Dr. Chockalingam is doing here, and that's what brought about, firm success, frankly. A year plus later, like a year and a month since it was completed, and I have no symptoms, no recurring symptoms of dizziness at all. There was looking back on it, when he was treating me, it did bring gradual improvement, which, I wasn't conscious, I wasn't trying to measure the change, from time to time, day to day, week to week. But, looking back, it definitely happened, and finally reached a point where I told Dr. Chockalingam, there's no symptoms, and he did the examinations again. He said, "You're right. There's no eye fluttering, as I call it." And in terms of tips from my own experience, I again recommend, strongly that the exercises that he dictates should be done at home, just as he says, and also in follow-up after the treatment is complete. Another tip, this happened to me, in my 50s, and that's, as I've learned, that's a time when I can't just move quick and fast and do the things I used to. I had to learn to recognize the limits that come on with aging, and be wise about it. Be careful. If I was more conscious of that, I would have never smacked my head in the first place and had the subsequent falls either. But with Dr. Chockalingam's help, it's completely gone and no recurrence.